a good indicator to detect active cancer?
So the short answer for breast cancer is no. Okay, so we have a few cancers that actually do have good tumor markers, things like testicular cancer and germ cell cancers, and maybe even prostate cancer where we can test for PSA in the blood. But in breast cancer, we have two markers that we frequently use. The one is BR15.3 and the other one is CEA. And these markers can sometimes go up with breast cancer, but they can also go up with things like, chronic obstructive airway disease and bronchitis and things like that. So they're not very good. So number one is they're not good to diagnose breast cancer. So they're not a good way for you to find out whether you have breast cancer. And secondly, they tend not to go up in early breast cancer. So if you have a patient that has widespread breast cancer and the markers are high, and we give you treatment and they come down, it helps us to say, okay, we think the treatment's working. But if the markers are normal, it doesn't mean that you don't have breast cancer, and it also doesn't mean that the breast cancer hasn't spread. So not very good. And in fact, whether you do the markers during follow-up or not, it seems not to make any difference in how well the patients do or don't. So yeah, one shouldn't, I always warn the patient to say, please don't sort of get completely upset by, what is my marker showing? Are they better or are they worse? They're one of the little things that we look at, but they're really not that important.